When we look at communication and message delivery, they say only 7% of the message that's delivered is actually determined by the words that we say. The other 93% is actually our tone, our body posturing, and our eye contact. I would argue that the way a patient responds to treatment is probably 50% or maybe even more than 50% directly related to our personal interactions. So just as important as our actual treatment is, I think our patient interactions can really have an effect on our patient outcomes. Interpersonal skills can be defined as a personal attribute that contributes to a harmonious relationship. So if I'm going to give you a parallel in the clinical setting, a soft skill or interpersonal skill would be the way we directly connect with our patients or communicate with our patients. Hard skills are more like technical skills, so that would be the ability to perform a specific task. A technical skill could be described as a manual therapy technique we decided to apply on a patient. The first impressions usually are made between the first 7 and 12 seconds. So it doesn't give us a lot of time. And researchers at Harvard have looked at what 2 questions people think about when they're establishing a first impression. And what they look at is, can I trust you? And can I respect you? And when they wean those down into characteristics, what they found were those 2 characteristics are warmth and competence. And warmth seems to supersede competence. So again, when we're looking at our soft skills or interpersonal skills versus technical skills, those soft skills or interpersonal skills are actually more important in making that first impression than competence or the ability to perform a specific task. So I think good nonverbal communication would be good eye contact, a non-forceful gaze, using body posturing that's open, that allows the patient to feel that they can tell their story, and the therapist not looking or appearing like they're in a position of power, but setting the stage for really good patient-centered care, that the patient feels that they're able to communicate and open and tell their story to the therapist. The words we say actually only account for 7% theoretically in the delivery of our message, but they're still very important. When that trust is established between a therapist and a patient, what we say is very meaningful to that patient. So making sure that we're aware of our language, that we're not instilling fear into our patient, that we're consistently trying to empower them with our words is extremely important.